What we're going to do is more or less split it down the middle. So I'll talk for about 15 minutes, probably 20 minutes maybe, about the first few chapters, and then Nick will sort of take up the rest of the story, as it were. The title of the book, Clear Red Water, refers to a speech made by the Welsh First Minister Rhodri Morgan in December 2002. And obviously the title is a play on words of Clear Blue Water, which was being used by the Tories a couple of years before that. And the significance of the phrase really is it was the first explicit acknowledgement of the fact that there was a divergence in key policy areas between what the then Labour government in the Assembly was doing in devolved policy areas and what the Westminster government was doing in the equivalent areas. Now, we're not naive enough, I think, to necessarily take politicians at their word and to assume that when this kind of distinction is drawn, that it's necessarily as substantial as it might appear. Nevertheless, the thesis of the book is actually that there is a significant divergence. It's one that we support. We think that what the Welsh Assembly government has done in areas like health and education has been more progressive than what New Labour has done in England. And while we are not uncritical of that policy agenda, we feel it creates an opening for the left and something that should generally be supported. And so really the book explains why it's not just a bit of rebranding. It is actually something that is worth supporting and worth fighting for. And what it amounts to really, I suppose, is an agenda that is more in keeping with, if you like, the mainstream ideology of the Labour movement up until the 90s, up until the New Labour period, which is generally within the context of mainstream social democracy, as opposed to the kind of acceptance of the sort of more neoliberal approach of New Labour, with the emphasis on markets and choice as a way of supposedly reforming public services. Now, to sort of understand or appreciate this argument, really, it's necessary to understand a bit of the context, and in particular the kind of prevailing values and ideas in the Welsh Labour movement, which go back to the early years of the Industrial Revolution. I mean, Wales was obviously one of the areas that, or South Wales anyway, was one of the first areas to really industrialise, and therefore it was also one of the areas that in Europe that had a working class movement as such, which of course came to the forefront in times like the Merthyr Rising in 1831, the Chartist movement also in the 1830s and 1840s, when there was actually a kind of military challenge to the state in the Chartist March on Newport in 1839. And that kind of tradition of working class radicalism really remains an important part of the Welsh Labour movement and the organised working class right the way through the remainder of the 19th century, through to the period really when we had majority Labour governments after 1945. Now, one of the kind of paradoxes is that having had this tradition of radical, working class militancy from the period really when Labour established itself and was able to carry out a lot of the policies that movement had demanded, things like the creation of the NHS, the nationalisation of significant sectors of the economy, and particularly, of course, in the Welsh context, the coal mines. From that period, the party became effectively absorbed, or at least at leadership level, absorbed into the political establishment, and therefore the period since 1945 was one of significantly less radicalism, when MPs, union officials, councillors and so on in Wales, if you like, adopted more of a complacent attitude towards political reform, and kind of horizons became narrowed. And really it's only with the full frontal attack on the gains of the Labour movement in the Thatcher period that you begin to see a sort of more of a revival of that radicalism. And the other theme of the book really is the sort of the Welsh national question and the demand for a greater degree of self-government. And whereas that had been something that was not necessarily espoused by the Labour movement in the pre-Thatcher period, the experience of 18 years of Tory rule, the destruction of the coal and steel industries and so on, helped to increase the level of support for self-government within the Labour movement itself, if only as a bulwark against further attacks on the living standards of working people. So the theme really is that devolution itself became in part a vehicle for a resurgence of a kind of socialist and radical tradition that had been somewhat kind of subsumed in the second half of the 20th century. And whereas New Labour represented an accommodation to Thatcherism on the part of the British Labour leadership, devolution allowed the Welsh leadership to go in a different direction and to reconnect the Welsh Labour Party with some of the progressive traditions of the movement. And that particularly came to the fore after the attempt by the Tony Blair leadership to impose Ali Michael as leader of the Welsh Labour Party and to follow a more orthodox New Labour regime. That attempt was overturned when Rhodri Morgan sort of ousted Ali Michael early within the first year of the Assembly having been established. Now that's all very well by way of background, but of course in order to sort of establish that there really is clear red water between Wales and Westminster, we need to look at the policy agenda that's been followed. And I think you can only really appreciate the significance of what the Assembly government has done in areas like health and education, where it has significant devolved responsibility, if you appreciate the extent to which New Labour has continued and pursued a kind of post-Thatcherite agenda in those areas. So, I mean, in health policy, to take that first, what New Labour has fundamentally done is to deepen the split between purchasers and providers that the Tories created when they introduced the internal market in healthcare in the early 1990s. And what this fundamentally means, as people like Alison Pollock have shown, is the breakdown of the idea of the NHS as a kind of coherent, integrated organisation that was able to plan and deliver healthcare according to the needs of a particular population, however imperfectly, and to break it up really into a series of business-oriented organisations linked by market transactions. And of course we've seen the pursuit of that agenda through things like foundation hospitals, through PFI and the primary care equivalent steps, and the offering up of certain core areas of NHS work to the private sector in the form of things like independent sector treatment centres, which are originally sort of presented as a way of dealing with a backlog of elective surgery in the NHS, but which have clearly basically been a way for the private sector to get rich by cherry-picking the most straightforward procedures from the NHS. There's also been the choose and book system, where English GPs have to give patients a choice of providers, including at least one in the private sector. And the overall effect of all this is to really elevate the idea of consumer choice above any approach to kind of coherent planning and something which is based on the needs of patients. Now, the Welsh approach has been completely different, and there have been mistakes, like, for example, when the first reform of the health service in Wales was introduced in 2001, the kind of commissioning function was broken up into 23 different bodies, which has now been regarded as a mistake, and it is being reversed. But the basic principles underlying Welsh health policy have included a rejection of the markets and privatisation approach, greater planning and collaboration, more of an emphasis on public health, in other words, prevention of illness, rather than simply curing illness that's existed or been allowed to develop, and particularly a recognition of the socio-economic factors that contribute towards ill health, which are particularly prevalent in Wales, which obviously has some of the highest levels of poverty in the whole of the United Kingdom. Wales hasn't generally followed the PFI route. There has been some PFI early on in the New Labour period, but not since the first couple of years of the Assembly. Things like hospital cleaning have been brought back in-house, which has contributed towards Wales having the lowest rates of hospital-acquired infection in the UK. Things like hospital parking charges have been abolished, and perhaps most significantly, certainly at a symbolic level, NHS prescriptions have been completely phased out in Wales, which is obviously now being pursued in Scotland as well. At the moment, the Welsh Health Minister, Edwina Hart, is delivering the coup de grace to the internal market in Wales, which never really existed in the same way that it did in England anyway, by recombining the commissioning and providing bodies. And so there's an explicit acknowledgement that Wales is trying to return to the kind of vision for the NHS that Aneurin Bevan had back in the 1940s.